Welcome to BOSTnet's training, All Means All, supporting students with ADHD, Attention Deficit Hyperactivity Disorder. First, let's take a look at the background behind inclusion. What does it mean to support students with ADHD? When you think of ADHD, you'll begin to identify your own preconceived notions. What do you think of when you hear these terms? You may think of children you've known or worked with who have ADHD. You may think of some of the challenges or issues that you've seen or experienced yourself. Today's session will help you reflect on your own experiences while preparing you with the necessary tools to support children who have ADHD. Before we begin, let's make sure we understand what terminology to use. It's important to note that the medical terminology has changed over time. Educators have now adopted the use of ADHD as the appropriate terminology. ADD is now considered obsolete or no longer used in the medical field. The term Attention Deficit Hyperactivity Disorder helps to broaden the spectrum and encompasses more children who may experience similar challenges while acting in different ways. Similarly, it's important to note that the language used to describe students with these conditions has also begun to change. While ADHD was previously considered more of a learning disability, educators are now encouraged to think of these conditions as exceptionalities. To give you a better sense of the history of ADHD, it can be interesting to look at a number of extremely talented people throughout history that may have had ADHD. Famous people include Benjamin Franklin, Wolfgang Amadeus Mozart, and even Leonardo da Vinci. These are just a few examples, and the point is that ADHD isn't necessarily anything new, but rather it's existed throughout human history and only relatively recently was identified as a medical condition. Unfortunately, before it was recognized by the medical community as a legitimate condition, it was stigmatized as a defect of moral control in the early 1900s, or even just was described as being high-grade feeble-minded. It wasn't until the 1930s, when doctors were working to discover new drugs, that they discovered amphetamines helped control hyperactivity. They noticed that the drug helped with impulse control. Still, though, there was no formal diagnosis. The labels for people with ADHD show our society's lack of understanding and awareness about what ADHD is. Many of these labels have lasted up until the 1980s. One of the most common terms for ADHD was what people called the clumsy child syndrome, and we can now look back and realize how unforgiving that term really is. In 1987, the DSM, the Diagnostic and Statistical Manual of Mental Disorders, changed the terminology to what we currently use today. Researchers are continuing to study ADHD since there is still a lot to learn about the brain and how it responds to impulses, as well as what's the best way to support individuals who experience these types of symptoms. There is still a lot of controversy about how we support children who have ADHD. And using medicine that was discovered over 50 years ago has long been the solution to the problem. However, many opponents believe that the medicines used to treat ADHD are really only working to pacify the problem and are the result of an approach that is outdated or even flawed. While the debate about over-medicating children continues, it's important to develop the strategies and skills for working with children who have ADHD, regardless of whether they are medicated or not. Some of the challenges or barriers that educators face are often a result of a lack of training or experience in working with children who have ADHD. You may find yourself fearful of doing the wrong thing or uncertain of how to manage a difficult situation that may arise. It's important to reflect on your feelings about ADHD and to come to terms with any preconceived ideas or beliefs that you may unknowingly have. For example, you might confuse a student with ADHD as someone who is willfully disruptive or just going through a phase, but likely that's not the case. Additionally, your program may lack the financial resources and community supports to educate staff about the diagnosis, which may be why you or your staff are having difficulty supporting these students, and is likely one of the reasons you're attending this training. Different cultures will have different ideas about the best ways to educate their child. Certain cultures may even be resistant to the diagnosis of ADHD, and families might choose not to have their child tested or even evaluated. While this training mainly focuses on students who have been diagnosed with ADHD by a professional, you will learn the strategies to help support those students who may be undiagnosed but do display a number of the characteristic behaviors. When having conversations with families where English is not their first language, it's helpful to find a staff member or community translator in the family's language of choice. When having those conversations, be sure not to communicate sensitive or confidential information with other people or even in front of the child. If you can, act as the liaison between the school and the family so you can possibly participate in the IEP meetings offered by the school district. IEP stands for the Individualized Education Program. Be sensitive about how the family might react to the diagnosis of ADHD and take into account their perspective on mental health, doctors, or even psychology. Focus on the child's well-being and create goals for the child that include what skills he or she will need to develop. When in doubt, ask questions and give yourself time to think about how you would respond. Write down your responses to make sure you are framing it positively. In preparation for talking with parents about the child's needs, it's important to plan appropriately for your conversation and structure your conversation to cover these things. First, focus on the child and ask specific questions about the child's needs. Ask about what the child is like at home and how the parents handle those difficult situations. Share your thoughts and opinions using language that highlights the child's strengths and identify 2 or 3 areas for improvement. Be sure not to overwhelm the families with a laundry list of complaints. Put yourself in their shoes and try to stick to action goals for the child. See if the family wants you to participate in school meetings or even to connect with the child's teachers. Speak to the teachers to hear how they manage difficult situations, and share the teachers' experiences with the families, being careful to reword or rephrase negative comments. Lastly, view the parents as the experts in this situation. They know how to handle their child and respect their right to a different opinion.